Hello, everybody. Thank you so much for joining us today for our Equity in Action Conversations with CareerSTAT Champions series. I am so excited to have you here with us for our 5th edition of this. To give you just a quick insight of how this conversation will go, I'm going to give us a quick introduction to the session, then we're going to jump into the interview with our panelists, and then there will be some opportunity for Q&A throughout. So through the chat messages, in various spaces, you can just ask those questions as they come to you, and we will get to them when we can. For folks who might be new for us today, just a quick overview of CareerSTAT, which is our national sector partner strategy here at the National Fund, and it is a key part to our Activate employer teams. Oh yes, I am Melissa Kleder. I am a senior program manager with the employer activation team. And so CareerSTAT is a cornerstone project of our employer activation, as is our Frontline Healthcare Worker Champion recognition program. And that was on a brief hiatus and relaunched last year. And we are thrilled and delighted to recognize 8 organizations for creating good jobs, building equitable workplaces, and making significant investments in the skills and careers of frontline workers. The Equity in Action series is really our way of inviting you into the conversation. One of the key principles of CareerSTAT and the recognition program is how can we share promising or best practices with each other so that we can be inspired and engaged to implement better practices within our own institutions and organizations. In addition to this, we will have another opportunity exclusively for CareerSTAT members to take a deeper dive into the conversation, and I'll have more on that later. But for the meantime, let's get to the real juice of this conversation. I'm delighted to have our friends Diane Toia, a senior workforce planning partner, and Jason Pacheco, director of workforce planning, analytics, and compensation from Baystate Health in Western Mass, join us today. Hello, hello, and congratulations on your champion status.
Yay. Thank you very much, Melissa.
Thank you.
So for those folks who have been tuning into this series, y'all are going to recognize my first question because I've been asking the same one every time. And really, it's an opportunity for us to just hear a little bit about personal workforce journeys in career navigation. So I would just love to hear briefly a little bit about how y'all got from wherever you were into workforce development as your career.
I'll start. So I came into human resources through really the recruiting arm. I had left college, got linked up with an IT recruiting firm, and was doing staffing for localization and internationalization engineers and all of these fancy sort of technical terms. I got scooped up by Baystate as a technical recruiter and came to Baystate, I think, back in 2007. So it's been a while now. And when I was hired, the VP of talent at the time hired me saying, yes, we want you to recruit, but we really want you to divine, some strategic pathways in order to get folks in. Well, that didn't necessarily work too well with our IT group. We continued to recruit for quite a while, but over time I navigated more towards workforce planning. And as an aspect of workforce planning, linking the business strategy, we ultimately arrived with creating workforce development solutions. I got integrated into the CareerSTAT Academy back in 2016 and met the great folks at the National Fund, and the rest is history. So that's how I got here.
And I actually started my career, I went to school for accounting. So I have a bachelor's in accounting and a minor in psych degree. And I started at one of the big 4 accounting firms as an auditor, and transitioned after about 3 years to be their campus recruiter out of the Hartford office, and then stayed there for about 3.5 years. I then was looking to pivot a bit and really immerse myself more in human resources as a whole. And I was presented through some networking of my own, an opportunity at Baystate Health as a career mobility consultant. So my title has yet changed between now and then. And really the role has shifted to workforce development. I've been at Baystate just about 6 years in September. And during COVID too, I really got a chance to work on our redeployment team and really help start to begin to looking at staffing strategies and pivot a bit more to workforce development. So since starting at Baystate to now, my role has pivoted a lot and really has immersed more in the workforce planning and development space, centered within human resources. So I got some HR certifications along the way, but my career definitely did not start in HR or workforce development. It very much started in accounting, public accounting.
I thank you so much for sharing those little tidbits about yourselves. I love hearing it, and I love it because it represents two things, right? That like career journeys are not linear, and that sometimes our careers take turns for our personal interest, or sometimes based on the needs of the business, right? Like there's an opportunity that comes up and it's like, I think I might be interested in that, right? So that there's lots of ways that our careers can create themselves and what that journey looks like. So I really appreciate you sharing that. And then to Jason, as you indicated, Baystate was recognized as an emerging champion, and then y'all participated in our healthcare workforce development academy. And from what I understand, your participation in those, you were really able to invigorate Baystate's workforce development strategy. And I would love to hear how you were able to connect workforce development to the business outcomes and the impact that had on like your strategy development.
Sure. Yeah. So as you mentioned, we were fortunate enough to receive recognition, I think back in 2016 or 2017 for Baystate Medical Center, which is our flagship hospital. Up until that point, we had really had sort of these bits and pieces of programs that were being developed, some on-the-job training for farm techs or medical coders. We did some small PCT styles trainings here or there as we could, but it was very fragmented. And one of the things that the Employer Academy through CareerSTAT offered us was an opportunity to really focus on one single project that lasted the year of the academy. And the one that Baystate selected was the update of our strategic workforce plan. So that's how we got connected to it. For those of you that aren't familiar with strategic workforce planning, we subscribe to HCI's sort of model where we begin and end with the business strategy. So it's really more about talking with the leaders and really understanding where the business needs to grow. And as a result of that particular academy, we used the time and project to take a look at our strategy and outcomes. And at that particular time, it really was more about making sure that we were preparing for the retirement bubble that was on the horizon. We had some scenarios. There were some scary nursing staff ratios. The pandemic, by the way, made those look like, walks in the park. But we had some scary workforce challenges on the horizon. And so as a result of that workforce plan, the forecasts, looking at what we needed to fill from talent, the gap strategy or the strategy to close the gap was really around workforce development. So we added a career mobility team, and Diane we're so delighted that she was able to join the team as our first career mobility consultant to look at internal pathways. We proposed leveraging apprenticeships. Baystate got its first apprenticeship back in 2016 as sort of a pilot, sort of twosies and threesies here. Now we have nearly a dozen programs that are in full swing right at the moment, and we talk about cohorts and leverage that. So that really was sort of a fledgling opportunity back then, but it was about closing the gap in workforce supply in order to meet the business growth strategies and the retirements. So as a result of the academy, we did that for our 3-year plan. We're on our second 3-year plan. So we've got one that takes us into 2025. This plan takes into account some of the growth strategy that Baystate wants to accomplish with growth in primary care access and increased capacity in some of our service lines. So we've mapped it out very specifically in terms of strategies. And as a result of that, we've mapped it back towards sort of retention, recruitment, and development. And so there's all of these outside in. The other thing that I'll mention is along the way, we really realized Baystate's mission, for those of you that may not be familiar with us, is to provide community-based healthcare, right? So that's, at the end of the day, that's what we're all about. We are interested in increasing the health in our communities. And as an anchor institution in our area, what we realized is one of the best ways that we could increase community-based health was to offer employment and sort of employment opportunities to those in our local organizations. So we mapped it out. We could tell you that there are significant differences in life expectancy between some of the census tracts that are closest towards one of our premier medical centers in downtown Springfield, Massachusetts, as compared to some of the suburbs. And we realized that we needed to be able to grow and hire folks from our communities. Which, by the way, had suffered some really significant growth and development opportunities over the last few decades. So Baystate's committed towards increasing what we call our impact hires by 10% over the next 3 years. And in order to do that, we need to do a lot of workforce development to make sure that they're coming along the journey for career pathways. Things such as apprenticeships, but it's not just apprenticeships, it's medical assistants, patient care technicians, sterile processing technicians, right? And then growing from there. So how do we get those patient care technicians to become LPNs and RNs so that we can increase our hires, provide sustainable, livable wages for those in our communities, and along the same time, provide them access to healthcare and what we refer to as the social determinants of health and have healthier communities.
Thank you for all of that. I mean, there was so much baked in there, but it really demonstrates to me that something that I'm always trying to share and help folks to see is that, like, this is a journey. Like, it's not just one of those buzzwords, right? That kind of feels like everybody's on a journey. But really, it sounds like y'all looked at both, like, what your internal goals were and how to connect your workforce development to that, what your community level goals are, how to connect workforce development to that, and that you tried things over time and things have evolved. Things that weren't working, you let go to be able to make space for new stuff. And it sounds like that's just kind of the mentality that y'all have taken, is that we create this plan and then we're going to be flexible to meet the needs and be able to have it be a 3-year plan so that we can check in on progress, but then also pivot to where we need for both things that we are well aware of, like aging populations, and things that might come at us that are unexpected, like a global pandemic. So being able to have kind of the flexibility, but a framework to really guide decision-making and guide strategy. Does that sound like a good recap?
Absolutely. You nailed it. Thank you so much.
Fantastic. Well, Diane, congratulations to you for being the first hire of this build out of a fantastic team. Now, quickly, this is a sidebar question, but so it started with just kind of like one person. Now, how many are you up to now?
I have 4 workforce planners, a workforce planning coordinator, and then 2 analysts that support the data that support some of that, and a manager of workforce development that runs that and our high school programs.
I think a lot of people who are listening in just became very envious of being able to have that staffing, and hopefully they can turn that envy into kind of some inspiration on how they might be able to do some of this. And what I really love to hear from you, Diane, is, how did this strategic plan help you, right? Like, obviously it created a position for you to be able to be hired and come in, but like, how are you using that now? How does that impact kind of your day-to-day work?
Sure. Yeah. And when I first started this role, I really had a focus on inside up. So looking at your incumbent workforce, how do you grow them internally? So whether that's transferring to a new job or putting them on a new pathway. But we can't do these pathways, right, without supports from whether it's local community colleges or partners as well to deliver training. So we, the workforce planning partners, so myself, would utilize our strategic workforce plan to really identify the critical jobs that we have. So for instance, nursing or patient care technician. So those were identified as critical jobs within the workforce plan for a number of reasons, like Jason mentioned, whether it's, lack of, pipeline. So there may not be enough PCTs to fill the open positions. So how do you tap into that untapped market, right? And develop individuals and to grow their skill set and develop that pipeline. So in my circumstances, I really focus a lot on the nursing pipeline and development at Baystate Health. So one pipeline is LPNs. So we hire LPNs at Baystate Health, and they are a critical job in nursing, but there's not necessarily a developed pathway for them. Exactly. So we developed one to bring PCTs to the LPN track. And that the strategic workforce plan helps you get to where you want to go. So identifying what the need of the business is, but then how do you solve whatever that gap is? So whether it's retention or recruitment, pipeline development, and then really looking at what the gap is. And then I would, in my instance, kind of say, okay, what are some feasible solutions to addressing that gap? So in our case, it was developing a pipeline strategy, working with local training providers, in this case, Holyoke Community College as a training provider, and saying, okay, how can we work together to identify this very identifiable gap that we have, but from an inside up model. So how do you grow internally PCTs to go on to that next step? So really define that pathway. So I would say that the strategic workforce plan is a guide for us in terms of, okay, we see what this is and projecting out what we think is going to be the need in 1 to 2 to 5 years from now. So how do we address that now? Because you can't address it in that moment, right? We have to develop the pipeline to make sure that we have enough staff and resources by the time you get there. So I would say from a nursing avenue, along with other different support areas, we really use that strategic workforce plan as our guide and roadmap to say, okay, what areas should we look at next, and really dive in deep to look at different stakeholders and things to help address that gap.
Amazing. I love that, again, for 2 reasons. One, practical application of a strategic plan. Love to see it, right? So often folks put a ton of work into a strategic plan, and then it just sits in a file. And then you don't look at it again until it's time to revise that strategic plan and to see like what we did with it and how we lived up to that plan. So I really love hearing about how that's a practical application. And I also love hearing how you talk about those allied health positions and building those out as a part of the pipeline to nursing, right? Like we know that there is a critical shortage of nurses, but starting there is kind of leapfrogging over, right? Where some other folks might need to build skills or build experience, and having those allied health positions that can then lead into LPN, and then LPN can lead into RN, I think is something that strikes me, right, as really important and something that sometimes gets overlooked, right? They think of where are folks coming out of graduate degree or, getting their BAs in nursing and starting there. And this is just a model that just takes it a step back of where might we start earlier in this process to get folks to where we need to be. And that also aligns with what they want to do with the careers that they're interested in. So I am looking at time, and I am going to encourage folks that if you do have some questions, populate them in the chat and we will work to address that. And while y'all are thinking, I'm going to move on to my last question here, which is that, Baystate also partners with Springfield Works, which is a workforce collaborative in Springfield and also a national fund site. And you have been doing some really interesting work to engage workers in the design of jobs or the design of programs. And I would just love to hear just any high-level insights that you have from that, and what's often referred to as a human-centered design, which is an approach that really is based on this idea that folks who are closest to the problem often have the best solutions for solving said problem. And so I'm just interested to hear a little bit about how has that experience been for you? Was it contentious to engage employees at that level or at that part of the process? I'd just love to hear any nuggets that you have.
Sure. So I actually had an opportunity to participate in a human-centered design workshop with Springfield Works and the National Fund, along with other community-based organizations in Springfield. And really, we dove into this LPN project from a human-centered design perspective. And it was really eye-opening for me. So typically when we design a program, right, you typically look at what the business needs are. How is this going to affect operations? How are we going to run this program? What is our pipeline going to look like for recruitment? And what was left out of some of our previous designs was that worker voice. So hearing from the person that this could impact, or hearing from the worker who is in that job currently that you're trying to develop a program for. So when going through the human-centered design workshop, along now, we're still doing this work concurrently with Springfield Works and the National Fund, bringing that worker voice to the conversation. So hearing directly from a PCT or a current LPN to say, this is my reality. This is what's going on a daily basis. These are the things you really need to consider, and the different personas represented amongst the design team. So typically when we would design, say it was the Baystate, a training provider, maybe another employer partner, some leaders, but that worker voice wasn't included. So now including that voice, we may think, let's do something one way. And then you have the worker say, well, this doesn't really make too much sense in terms of like, how is this going to affect my daily life? How is this going to affect my childcare? How is this going to affect my work life that I have currently if you're trying to put me in this new program? And really helping identify barriers that we didn't know existed previously. Just access to technology, access to laptops, access to even smartphones to do some of the onboarding paperwork, different things like that. And once you bring that voice into the conversation, you start designing a program that is going to fit with that worker. And you're designing it to help that worker be successful upon completion because you heard directly from them during the whole process. So you're not hearing from them of, it's not just a title and a job they're achieving, right? There are other things that are happening that is driving them to get to that next step. So including that worker voice in the front end of it, I think for me has been extremely eye-opening. And every time now I approach a different program, or even just, how are we selecting candidates in, or having them opt out after they're well educated on a program is very different approach than I took, say, 6 years ago when I first started. So this work is very important. And I think having that worker voice part of the conversation is only going to help with the result once the program is complete, and to make sure that worker is supported along the way and then after the training's done in that new role or position or path.
Love that. Jason, anything from your perspective?
I just want to add two points to kind of round out a little bit. One, this was an 18-month sort of design process that took into account what is the same team members on that Springfield Works site, right? So it was us coming together from a partnership community standpoint, identifying a need, coming up with a program without having a funding source, and then finding the funding source to find it. Sort of that journey to the worker's voice category. Just to put some numbers on it, Diane opened up the application for the program, and and mind you, it was just open to internal Baystate Health employees that were looking towards developing into LPNs. Within 8 hours, we had 300 applications. We left it open over the weekend, and I think, Diane, you ended up with 500 applications.
Yes.
So when we talk about workers' voice and sort of their interest in wanting to be part of the process, it was just tremendous. And the issue is, how do we get down from 500 to a cohort of 25?
Right.
But we've used our colleagues at the National Fund to really bounce those ideas off of, and as Diane mentioned, screen in and then help them opt out, but from an educated standpoint.
How exciting. Oh my goodness. Like, that's huge. And I mean, for your context, even like, what would you say like previous program application may have looked like?
I think you may have still had 500, but I think I would have approached the recruitment process much differently than I did going into this. And thinking through this, out of those 500, I individually spoke to over 100 employees and really tried to understand their why. Like, why are you looking to do this? It's not just a title change, and hearing their individual stories was very eye-opening for me. And now that we're almost to selection of the pay to train candidates for these 25, I am so beyond proud of those that have gotten through this process, especially as they overcome different barriers, readjusting work schedules. These employees are so dedicated. And I think I would have just approached it differently had I not been educated on the human-centered design approach.
Well, that's really exciting. All right. So I do not see any questions here, but I know that you all might be holding them. So I'm going to go over some closing things. And just in case you need a little bit more time to formulate your thoughts, to type in your questions, because we would love to hear from you. And as you know, any CareerSTAT event, if you are an attendee, you're also a participant. That's how things work. We all love to have we're all experts and we're all learners in this space. So it's really great to hear from you all. And if you have something to share about your work, we would also love to hear that. But in terms of some upcoming opportunities and some additional ways to be connected, I'm going to jump into those and then just check back to see if we get any questions. As always, you can continue this conversation via Mobilize, which is our online community of practice. And then our CareerSTAT exclusive peer learning deep dive, a snappy little title, is scheduled for July 17th. And we're going to drop a link to that where y'all can register. That's going to feature Loretto and Baystate folks, where you have an opportunity just to dive in and ask some more questions. Also, our next interview is going to be on July 10th. So be sure that will happen. We are working on some scheduling to see exactly who that would be. So I'm being a little vague. That's why we're still trying to figure out who's going to fit into that slot. But the other thing to have on your radar, and a great opportunity to really celebrate all of our champions and get connected to them in a meaningful way and to really get some inspiration and energized, is to attend SHIFT, the National Fund's biennial convening. It's happening September 27th through the 29th in Memphis, Tennessee. And the registration early bird rate ends this Friday, July 14th. And so I encourage you, we will also drop a link for that to look at the convening. More details are coming soon on the exact sessions, but what we've featured here throughout this series on ways that employers can connect with one another to learn about practices to make workplaces more equitable, accessible, and diverse is going to be front and center at SHIFT. So I just encourage y'all to look into that and see if you're able to join. And then, of course, we always have the loop to join CareerSTAT. So while that session is exclusive to CareerSTAT members, just know that it's easy to be a CareerSTAT member. It's free and easy to join. Okay, so we have a question here from our great friend, Kristen. And the question is, could you share more about how you did advertise the opportunities, or if there was any feedback from employees on the best way to advertise opportunities?
Sure. So we have like an intranet internally called the Hub, if you will, at Baystate Health. So we did advertise it on there as well as our Baystate news flashes. But also, I attended multiple nursing director and manager meetings to communicate what this program was, to tell their staff. In addition, I did see a question as well regarding how do we just communicate to incumbent staff for any opportunities. And we really try to get into the organization. So whether that's attending staff meetings for our food service, or environmental services, to really get the message out to the staff in real time, help answer questions. Also, for the LPN program, I held information sessions. So for those interested, so they understood the program as they were applying, to say, maybe this is for me, maybe this isn't for me. And also our community-based organizations do a great job also of advertising from the external perspective. But internally, we really tried to get out there and meet the staff and educate and have them opt in or apply to opportunities that we are offering. And we just started this new series called Workforce Development, or What's New in Workforce Development, that we're going to hold monthly for incumbent workers and external candidates, to just educate them on what is workforce development and what do we have to offer now, upcoming deadlines and timelines, and what does this program mean if you were to get accepted to it, and what does this pathway look like. So we just try to educate as much as possible so the staff are aware, but also so they know what they're applying to, and what this career could look like for them.
Great. We have 1 minute left, but that just sparked a question for me. So can you tell me a little bit, like, are those sessions happening during work hours? Are they happening over lunches? Are they happening after hours? When's like the timing? Have you found a time that works the best to actually reach the most amount of people?
It varies. So going into the staff, sometimes they'll invite us to staff meetings. I have found trying to attend nurse leadership staff meetings that are already on their calendars for me to go and educate is a good time because it's already scheduled and I can come as a guest to educate and teach. In addition, I know some of my colleagues will go to staff meetings, so they'll go meet the staff right where they're at in their department. And a lot of our workforce development programs, education sessions are held after hours. So to try to ensure that the night staff can come before shift and the day staff can come once shift is over.
Great. I love all of it. All right. Thank you so much. We are at time. This has been a great conversation. I told you it would go quickly because y'all have great practices to share. I appreciate you carving out some time in your busy day to come and share this broadly with our folks and our members. And congratulations again on your champion recognition. And I'm excited to continue this conversation both on Mobilize and in our peer learning session next month.
Melissa, well, we appreciate the opportunity and the support that National Fund has provided to us to get us along this journey and your continuing partnership and collaboration. So thank you.
Ending on a love
Thank you.
fest, the best way. All right. Thanks, everybody. Have a great afternoon.